Greetings. Welcome to the Brain Gauge channel. I'm Mark Comerdahl, and I just want to do a quick case study series. And this was actually something that was put together by Theresa Horab of Mind and Body Family Health Center. And she uses the brain gauge extremely effectively and alongside the IASIS microcurrent neurofeedback system that she uses. And let's just take a quick look at what she's found. I mean, she really has put the brain gauge to good use. But just the quick overview of this is that there are three individuals, 1, 2, 3, and we're looking at their results from their brain gauge testing before and after treatment. And the treatment duration varies. In the first case, it's 3 months. Next case, it's 1 month. Last case, it's 4 months. But basically, what you see here for each case, without going into overall details, of each case, you see a huge improvement before treatment and after treatment. And over here, we'll just real quickly, this is a 36-year-old female who had, OCD, was exasperated with the pandemic. And, clearly she was unable to focus, and that's reflected in her focus score, obviously. And she had a lot of anxiety and a lot of poor sleep. Over here, her sleep has improved quite a bit. Her anxiety is much reduced. And you can tell that basically all her scores have given you a quantitative assessment of how much better she's doing. So, self-perception was that, she had a decrease in fears, and she was no longer having facial tics, and she was working again, whereas before she couldn't work. But, those things just parallel how well the quantitative assessment of the brain gauge showed. Next patient is a 19-year-old male, and he had a second concussion 1.5 years ago. And sometimes chronic concussion can be a real problem. You get the post-concussive symptoms that can last for a really long time. He was unable to focus is one of the problems, and unable to concentrate. That's really reflected in the focus score here. And basically, again, poor sleep, self-medicating, and was prescribed anti-anxiety meds or anti-anxiolytics. But over here, he's got some really good scores now after treatment. I mean, these are really tough to see these good of scores. His overall score doubled, from 45 to 88. His focus score from 5 to 69. But the IASIS microcurrent treatment obviously worked extremely well. And over here, next patient, 11-year-old male, had ADHD and was on meds. Basically, obviously had pretty poor scores, but had a lot of difficulty with focus, which like most ADHD kids do. But obviously his focus score has improved quite a bit, and all his scores are actually improved. TOJ, if you look at the raw data, actually improved, but it's still a little bit off scale. So, he's still got a ways to go on that one before he gets better. But man, the improvements that these people are showing are really, really remarkable. Really impressed. And I hope that we'll get Theresa on, and we'll talk a little more extensively about each of these patients. But for now, I just wanted to give you a quick update on that case study series. And if you want to, thanks for watching. And if you've got a case study or another question, just send it my way. And hope you have a great day.